Juvederm Ultra, it's very thin, but it's going through that. And sometimes people don't want to do anything, so I can actually recreate the wrinkle because I can squish on the muscle and I can just say, oh, that's where it's going. One of the topicals has some epinephrine in it, so it blanches the little tiny vessels, because remember the face is very vascular and we want to be able to make sure we don't have a lot of bruises, because some ladies don't even tell their husbands they get Botox, and so if I have matching bruises, it's a really hard day at home. Who needs filler? If I go like this and the lines are still there, then they need filler in my mind, because this is what Botox will do for you. But now, I should have shown you that beforehand, but now when the Botox sets in, it's going to be nice and flat. But when it's flat here, I don't want it to be full here. And people say, well, maybe it's because my sunglasses sit here, but I don't know what it is either, but I think we lose some soft tissue puff here. Guys, because you know what? Who doesn't like to see a guy who looks good and confident, but not effeminate? Because that's the key thing with a lot of men. If you put stuff in the same place as you would for a woman, they're going to look effeminate.
Yeah, that's why I worry, I don't want to look like, I just want to look like myself. I lost 45 pounds and I'd like to look a little lighter because my skin is still hanging because it was fatter. Now it's not, I mean, that's not.
And fat was the original filler.
Yeah.
And the thing is, when you lose fat, you're going to lose it in your face first, and if you're a woman, you're going to lose it in your breast second, before it comes off your hips and your belly. So oftentimes we do a lot of guys, because what's interesting is the guys are saying, like, not only because they lost weight, but because they say, I'm in business, I'm working, I'm 50 something, and all the young bucks are up against my things.
I see beautiful people every day. So.
See? And the thing is, no one can kid themselves now. Beauty is a commodity. Attractiveness. If you look at George Clooney, his brow is lower. If you look at who's going out with Katy Perry, Orlando Bloom, his brow is higher, so he's more of a girly man. You look at the Brad Pitts, they're horizontal brow. Okay. Scale again for me. Okay. And I was trying to explain to my nurse, how do you put the Botox? And I said, go straight in and don't hit every single sensory nerve on me. So I try to go in straight right in there. Her skin's not super thick or anything like that, so she only needs a little touch, because if I throw more product at her, then she will potentially be more like opened up here and then like this. Can smell again. The other thing is that the economy drives a lot of what people do, because a lot of people can't take time off to have a facelift or to have eyelids. And they can do a little pick-me-up and they want just a little pick-me-up. Picture of what you looked like a couple of years ago, because you know what, not that I can reproduce it, but I kind of get an idea where you came from, Big smile. Let's fix this bit first, because this distance, the bizygomatic distance, determines the width of the face. So usually I'll do this Botox here, but I'll do this before I do anything else, because if I get this full, then I can get everything to count there, because really we want to be in the triangle of youth versus the pyramid of age. The pyramid of age is when we have all this stuff hanging down here. So we want to be able to take the face and make it to get rid of gravity, and that's really what we're trying to do on these ones. So no. It's broken down by your own intrinsic hyaluronidase. It leaves a small trail of collagen, and not a lot, but a little bit. Tell me a picture of it.
When you inject, you go like that.
That's a crow's feet line. See the muscle going like that and grabbing the skin. So if I look at her here, she's got nice, what we call the OG curve. So the distance between her lower lid and her cheek is kind of higher. And I just need a little blend right there. Sorry for playing. Where her canine tooth is, the eye tooth is, we lose soft tissue right there. And so we lose support of the mouth, and the mouth tends to give us that little oblique lie there. So how do you fix it? I have no clue. I just fill it. And you can see also she's got a little collapse right there, that little line there. So I'm not going to make her lips big because it won't go with an Irish face. A tiny little pinch. This is Juvederm. 1, 2, 3. It's like colouring. You don't want to just get it from one end. So I usually will go through and I'll get it from another end.